You've probably heard that over 80% of strokes are preventable. And yes, that's truly good news. Yet, even knowing this, I see so many of my patients overlook some very serious stroke risks every single day. We often focus on blood pressure, cholesterol, and medications, but there's something fundamental we almost always forget: water. Today, I'm going to gently explain exactly why and how drinking water correctly can significantly help you prevent stroke and heart attack in 4 simple, practical steps. Step number 3 is especially important. I've found that over 90% of older adults get this one wrong. First, let me briefly explain why water matters so much. Have you ever wondered exactly what happens during a stroke or heart attack? Both these frightening events happen when a small blood clot blocks blood flow. For a stroke, this blockage stops oxygen-rich blood from reaching your brain. For a heart attack, the blockage stops blood from getting to your heart muscle. The common link is clear: blood clots. And here's the important part: dehydration, or simply not drinking enough water, plays a direct role in creating these dangerous clots. When your body lacks proper hydration, 2 serious threats quietly develop. The first threat is what we doctors call thicker blood. Here's exactly how this happens. When you become dehydrated, the fluid in your blood, called plasma, drops significantly. This increases the concentration of red blood cells, platelets, and proteins, causing your blood to become thick and slow-moving. Thicker blood moves sluggishly through your arteries and veins. This makes your blood cells more likely to clump together, forming tiny blood clots. And unfortunately, these clots can travel silently, blocking arteries leading to your brain or your heart, triggering strokes or heart attacks without any warning signs. The second threat is the extra strain dehydration places on your heart. When you're dehydrated, your total blood volume decreases. To compensate, your heart must beat faster and harder to keep blood pressure stable and to push blood through your body. Imagine asking your heart, already aging and possibly dealing with other health conditions, to suddenly take on more work every single day. Over time, this continuous extra stress significantly increases the risk of a serious cardiovascular event. So it's clear, the simplest, most direct way to reduce these risks is by maintaining consistent hydration, keeping your blood flowing smoothly, and easing the unnecessary workload on your heart. Here's exactly how to do that, carefully and simply, starting today.
The first rule is consistency is more important than volume. Sip water steadily throughout the day rather than drinking large amounts at once. Many of my patients mistakenly believe that drinking around 64 ounces or 2 liters of water daily is enough, no matter how they drink it. But here's what often happens. They forget to drink all morning, then try to catch up by drinking a lot in the afternoon. Unfortunately, this method greatly reduces water's protective benefits. Your kidneys sense the sudden overload and quickly flush the extra water out, leaving you dehydrated again shortly after. This creates a dangerous cycle: short periods of hydration followed by dehydration, increasing your risk of blood clots repeatedly. Instead, just keep water in sight, near your favorite chair, on your desk, or by your bed. You'll find yourself drinking more naturally this way. You can also try habit stacking, meaning pairing drinking water with daily routines, like a glass of water right after you wake up, another before preparing lunch, and another when returning from your daily walk. Prioritize your mornings. Nighttime is the longest period your body goes without hydration, leaving you mildly dehydrated each morning. Starting the day with 1 or 2 glasses of water rehydrates you and naturally thins your blood, immediately reducing your risk. I understand many older adults worry about drinking water before bed, fearing it might disrupt sleep with bathroom trips. That's a very real concern. Simply reduce your water intake 1 or 2 hours before bed for restful sleep while staying properly hydrated. The second rule is straightforward. Choose plain water as your main drink and strictly limit sodas, fruit juices, sweet teas, and sugary drinks. Not all liquids hydrate equally. Sugary beverages cause 2 main health problems. First, they increase inflammation throughout your body, damaging blood vessels and increasing plaque buildup, raising stroke and heart disease risks. Second, sugary drinks spike your blood sugar levels repeatedly, increasing your diabetes risk, another major risk factor for stroke and heart attack. Now, a quick note on caffeine, like coffee or black tea. Caffeine has a mild diuretic effect, causing your kidneys to flush more water. For most people, a cup or 2 a day isn't problematic, but excessive amounts can lead to water loss. Plain water remains superior in providing true hydration. You might wonder about diet drinks, since they contain no sugar. Well, while they don't add sugar, they also offer no nutritional benefits. They're essentially empty fluids that do nothing to support your heart or blood vessels. Plain water always remains the healthiest choice. If you find plain water boring, don't turn to sugary drinks. Instead, try adding lemon slices, cucumber, mint leaves, or berries for flavor without sugar. Unsweetened herbal teas like chamomile, peppermint, or ginger are also excellent healthy alternatives, warm or cold. The third rule addresses a very common misconception. Drinking water with meals is safe and actually very beneficial. You might have heard the myth that drinking water during meals dilutes stomach acid, harming digestion. While common, this advice is outdated. Your stomach is incredibly adaptable, automatically producing the perfect amount of acid during meals. Water actually helps digestion, softening foods and making it easier for your digestive enzymes to work effectively. Drinking water during meals also aids swallowing, especially important for older adults and anyone experiencing swallowing difficulties, dysphagia. Taking small sips of water while eating softens food and prevents choking, a genuine, serious risk in seniors that can lead to dangerous complications like aspiration pneumonia. Also, meal times naturally become excellent opportunities for hydration, especially since our sense of thirst weakens with age. Simply keep a glass of water at your table and take small sips throughout meals, especially after drier foods or if you're taking medication with meals. Finally, the most important rule is this: don't rely solely on thirst. Always speak to your doctor about how much water is right for you. As we age, our thirst signaling mechanisms become weaker, meaning we might already be mildly dehydrated by the time we feel thirsty. So, instead, be proactive, sipping water throughout your day.
A simple check. Look at the color of your urine. Pale, straw-colored urine means you're well hydrated. Darker urine clearly signals dehydration. Here's an important safety point. While hydration is crucial, drinking too much water can actually be dangerous if you have specific conditions, especially congestive heart failure or chronic kidney disease. In these situations, your body cannot process excessive fluids properly, leading to swelling, breathing difficulties, or severe heart strain. So, please, next time you see your doctor, treat them as your partner. Ask directly, based on my conditions and medications, how much water should I drink each day? Knowing your personalized number is one of the safest steps you can take for your health. If you found this video helpful, please take a moment to subscribe, like, and share it with your loved ones. Your support is deeply appreciated and motivates us to create more helpful content. Also, please leave your questions below. I'd love to help further. Your health truly matters, and you deserve to feel clear-minded, strong, and safe every single day.